So really, in various different parts of the grant, we certainly want to do some of the more novel benchtop type research that Zoe and Jamie talked about today, but we also wanted to try to get some hands on the ground, field evaluations, proof of concept. So the one area that we had identified initially was looking at, it really was titled in and around sow lameness, but as I really thought about it, I wondered if it wasn't more just about identifying at-risk sows in general. So what I'm going to share with you today are the results from one of those evaluations that we completed in June, and then doing some of the follow-up with the farm here post the time that we left the farm. So really the objective is to try to test strategies of identifying and then ensuring that those early at-risk sows are treated in a breeding herd to maximize sow survivability. And really wasn't anything particularly scientific other than just going through with the farm staff in the morning while they were feeding and making absolutely sure that we had identified the sows that did not get up to feed, and then we would come back later at a later point to go ahead and do further evaluation, and then according to the farm's SOP ensure that they got appropriately treated. So kind of the idea behind that was, and based on a little bit of data that I had a summer intern when I was working at Smithfield found was, hey, if we did a better job of ensuring that we identified those at-risk sows in breeding and gestation and make sure that they got appropriately treated, could we influence overall sow mortality simply from doing that activity? So like I said, I had a summer intern, just a real short project. She was in there Monday through Friday for about 7 weeks in a 2,500 head sow farm, and all she really did was walk the gestation barns as the staff was going through doing their morning feedings, and she would just walk around and identify those sows that weren't eating. And then after that was all done, sows got back down, she would go back through methodically and then kind of look at each of those individual sows and collect a little bit of data and then treat them according to the SOP. And what you saw here over that very short time period was it had pretty significantly reduction in the number of dead sows per week for the entire farm, just simply by doing that simple activity on Monday through Friday. So that was really, the effort was to say, hey, that's a little bit old and you had an intern doing it. Could we do the same thing? Could we replicate that with the on-farm staff? And could we see something similar to that? So the idea with that was just to kind of walk through working with the farm staff for about a 2-week time period, train them, and then really kind of walk away and see if that was something they could continue to do. And like I say, it really wasn't even about the antibiotics that we're using. It was just like, okay, we're going to identify these animals. You use them according to your SOP to evaluate them, and then we'll just track mortality. So we also did kind of do a time requirement because we just wanted to understand if that was going to require extra labor to go ahead and do that. So we kind of kept track of the time it took to go through and do that. And then really the part of it was the kind of in that 2-week period. The first week, the veterinarians from ISU, we kind of took the lead on it, worked with the farm staff to kind of train them. And then the second week, we kind of let the farm staff kind of take over, and we were just there kind of to help and make sure that they were identifying them, getting them appropriately treated. A secondary objective within that is we wanted to look at some additional work when we came back to those sows, doing a physical exam. Then we also collected blood to look at CBC, serum chemistries, and then we attempted to collect urine to try to do some urine analysis as well. That was kind of a secondary objective inside of that. So a little bit of the farm background. Our partners at Iowa Select Farms were good enough to give us a farm to work on. It's about a 4,000 head sow farm. It's a little bit older building that had kind of been added on over time. So we had 3 separate gestation buildings. They were pretty much all stalls, a few pens for opportunity sows. But once again, just want to remind you, we did absolutely no evaluation in farrowing, even though the overall metric was overall sow mortality. So we did nothing. This is strictly a breeding and gestation type of function. Conventional standard health PRRS mycoplasma positive, feeding a mash feed, dropped in feed boxes, fed 1 time per day, first thing in the morning. The farm up until that point, it probably averaged over the first part of the year about a 17% mortality. And like we said, we took about 2 weeks, Monday through Friday, went out there working with those farms. So what we really did, as we said, we would go in, they would drop the feed, and then we'd split up. We'd have 2 teams of 2, one Iowa State vet from VDPAM from the Swine Medicine Education Center, a couple of postdocs or faculty work closely with them. So we'd have 1 person in front, 1 person behind, and our job was really to go ahead and really on the initial evaluation, all we did is flag the sows that didn't get up to eat. You know, if you have gone in and fed sows in the morning, you know that can be pretty loud, and you know they're hungry, right? They haven't been fed for 23 and a half hours, so they get up right away. Any of the sows that didn't get up, we just simply flagged them with a card. So then our goal was to do that, because as you're sitting there doing those evaluations, you know, those pigs will eat, you know, 4.5 pounds pretty quickly, and you want to get to the other end of that gestation barn before sows start laying back down. So here's just simply, you know, what we were looking for, right? So you got other sows up there around there eating, clean their feet up. Now you got one there that didn't get up for the day and didn't eat. Simply flagged them, came back, utilized the farm's treatment cards and their SOPs to go ahead and treat them appropriately. And that was really kind of the key, I think, for this farm is, you know, the gestation staff saw immediately value in it, because it was a little bit older farm. Getting dead sows out of gestation was really a chore, even with a Hercules device, right? So what they immediately saw value in this to say, hey, if there's something here, that's fewer dead sows we gotta take out, try to wedge out, and takes a fair amount of time to be able to do that. So the idea, once again, was just to go ahead and flag them, and then after the feeding, then we would go back through and do the evaluations, use the farm's SOP. We'd go ahead and take a physical, kind of get the sows up if they hadn't gotten up, you know, to assess any sort of lameness or wounds, to try to get an idea of their mental state. We went and took rectal temperatures as well, and then we would treat them appropriately according to the SOP. So like we said, we did the case control study. The lab, we're just about finishing up the lab results, but essentially what we would do is for every sow, we kind of look for the 30 at-risk sows that we identified, and if we found one, we would go ahead and find a parity match control, a normal sow in that same group, in the same breeding group, same parity. You know, generally we were within about 5 to 10 stalls, so we wanted to make sure we got them in the same general area, and we were able to get CBC and serum chemistry on the 30 cases and the 30 controls. Urine analysis, we attempted to get that utilizing a tampon method that Dr. Nickel did, who's a SMEC postdoc, and during one of her internships, she found that was a successful way to go ahead and put those in there, put a piece of duct tape on it, come back later, collect it. We got about 55% of them, so about half of them we could go ahead and get urine out of them at that time. So just kind of wrapping up, what were our clinical signs? What did we see? You know, off-feed was really the primary cause, so if we tracked any and all clinical signs on those at-risk sows over that 2-week time period, you know, about a third of them had 2 symptoms, the most common one being off-feed, and then probably they were off-feed because they were lame. You can see lameness was found in about 23% of the cases, and then just a smattering of a couple of the other reasons in there as well. We went ahead and tracked parity of all those animals as well, and really kind of echoes what Dr. Ketchum was talking about the other day. Those gilts and young parity, those are really the opportunities there. Those are the ones that we found most often were off-feed, or we considered to be at risk, were really gilts were the predominant ones that were found on there. So what we learned, kind of finishing up, still collecting data from that. Like we say, the farm was really good. They bought in. They took it. We just took the data, and really in this one, it was really just a simple before and after study. So we utilized a little statistical process control, looking at data from the beginning of the year. Once again, this is sow deaths per week for the entire farm. So once again, this would include sows that would die in gestation or in farrowing. And what we've seen here and continue to kind of see that downward trend is about a 3.3% reduction in annualized sow mortality, even though we haven't done anything at all to address anything in the farrowing barn. So we looked at the time commitment. As we did it initially, it took a little bit longer, but by the time we got to the end of the training, it averaged about 2 hours per day for at-risk identification. And like I say, a lot of this can really be done, normally we've got people, they drop feed, then they're with the brooms, scooping them and making sure back in. So just to make sure that they've got some cards, and as they're going through and checking those sows, that they're flagging them. And then essentially, I think what the farm migrated to is, each of the barn managers, they go ahead and flag them, and then they've just trained one person to go ahead and go through it later at a time of day where it worked best for them, generally in the afternoon, and then made sure that the treatments were done. And we found that helped decrease the treatment variation, because, as we were going through it towards the end, we kind of just did a spot check of the treatments that were being used compared to the SOP, and we certainly found some variation, as you would kind of expect, depending on who the barn manager is. The farm manager just identified one person to go through all those 3 gestation barns in the afternoon to go ahead and do those treatments. So I know Dr. Schultz is working as mortality calculator. I heard Caleb Scholl quote a number saying that 1% of sow mortality is worth about $2.80 per sow. So that kind of improvement, if that's sustained and if it's real, it's, he can be about $9 a sow or 92 cents a wean pig if you just count one parity cycle. So real quick, simple, easy. I'll go ahead and turn it back to our moderator, and I'll answer any questions during the open panel discussion. Thanks for your time.